Hello, my name is Dion Dratica, and I'm a clinical practice leader for Alberta Health Services, Pharmacy Services. I have been involved with the patient care process development, and today I'm going to walk you through the drug therapy assessment portion of that process. My clinical practice is in general internal medicine here at the Royal Alexandra Hospital. And in that practice, I have precepted both second and fourth year pharmacy students, as well as pharmacy residents. So now let's turn to drug therapy assessment. The focus of this section is precepting drug therapy assessment. This will involve a quick overview of this process, as well as guidance on providing feedback and evaluating your student. More detail about questions and approaches to use with the drug therapy assessment is in the patient care process document. Finally, this section will finish with an overview of the preceptor role as you navigate through this process with your student. Before getting into the specifics of drug therapy assessment, it is important to set the stage with your student. The first aspect to setting the stage involves identifying and evaluating how you assess your own drug therapy in your practice. Some questions that you may want to ask yourself may include, what is your practice environment? Are you community-based? Do you work in an ambulatory setting? Or do you work in an institution? Who are your team members, if any? Do you practice independently? Or do you routinely interact with other team members for decision making? And if you have other team members that you routinely interact with, who are they and what role do they play? It is important that you get to know your student, specifically their comfort and experience with drug therapy assessments. So some things that you may want to learn about your student early on in the rotation include how many drug therapy assessments have been learned and practiced, and what specific drug therapy assessments have been learned and practiced. Before starting to assess drug therapy, it is important for your student to understand the scope of your practice and the types of drug decision making you are involved in, as well as how you routinely make interventions after assessing drug therapy. The third aspect to setting the stage involves sharing your approach with your student. What types of drug therapy assessments do you routinely conduct? Are they primarily based on certain specific disease states, such as diabetes, heart failure, or hypertension? Or perhaps your assessments revolve around drug therapy problem categories, such as indication, efficacy, safety, and adherence. In your own current practice, do you routinely assess all four areas of drug therapy problem categories? Or do you have a more primary or greater role in assessing one area, such as safety? It is also important to discuss with your student where information is documented and stored that supports your assessments. Some examples may include past medical history, Netcare data, or refill records. When following the drug therapy assessment process outlined in the patient care process document, drug therapy problems have been categorized into the following four categories and arranged in this specific hierarchy. They are outlined as indicated here. Number 1, indication. Number 2, efficacy. Number 3, adherence. And number 4, safety. Students are taught how to assess each, and the patient care process document provides them with the more detailed approach of how to complete each section. After your student has gathered a patient database, have them present to you the indication for each drug. After meeting this specific drug therapy problem category, move on to the next problem in the hierarchy. So this would then apply for efficacy problems, adherence problems, and finally, problems that deal with safety issues. This flow diagram, which is easier to read in the patient care process document, outlines the main decision points with each area of drug therapy assessment. The prompting questions are there to direct students, and can also be used by you, the preceptor, to help direct or in some cases redirect the student as required. Have your student use the flowchart as a guide when evaluating drug therapy. Keep in mind that the flowchart is not all-inclusive, but rather a systematic process tool. For more comprehensive information about assessing drug therapy, refer your student to the full patient care process document for suggestions. Now let's talk about reviewing your student's assessments. It is important to determine whether your student's assessments are thorough, accurate, and clinically relevant. Often students have missing information and therefore do not have a thorough assessment of their patient. It is important as a preceptor to help them determine what information is needed and how it will be gathered. Some potential sources to direct or redirect your student to include the chart, the patient themselves, Netcare or other electronic health records, the community pharmacy, various physicians that have been involved with the patient's care, and other allied healthcare providers. In addition, sometimes assessments are inaccurate or not clinically relevant. Sometimes this is a result of information that is misinterpreted, or the student has been focusing on information that is not relevant to the problem at hand. And it is the responsibility of the preceptor to know how to redirect your student. One precepting tip that is often helpful when assessing your student's assessments is think about role modeling for your student. And one particular role model that you may want to emulate is that of a detective, thinking about how you would gather and assess particular information to get to the net result. Feedback and evaluation. Providing feedback to your student is always important because this is how the student is going to learn what to improve upon for future patients. It is important to determine their ability to ask the right questions, which in turn forms the assessment of the patient. It's also important to assess their ability to interpret, integrate, and apply the retrieved data. And finally, they should be able to prioritize medical and drug therapy problems. When evaluating your student, it is important to utilize the following criteria: their overall ability to identify clinically relevant drug therapy problems, and also evaluating the quality of their drug therapy problem assessments to ensure that they are thorough as well as accurate. Please note, if the student is unable to assess drug therapy despite feedback and sufficient practice, please contact the course coordinator for future follow-up. Now let's discuss the preceptor role. The preceptor role can be broken down into 3 different categories: before the placement, early on in the placement, and then as the placement is progressing. Before the student arrives on rotation with you, it is important that you be familiar with the drug therapy assessment process that the students are taught, and this is outlined in the patient care process document. It is also extremely helpful for you to contact your student prior to the start of their placement and suggest medical conditions and/or therapeutics your student should review that are commonly assessed in your practice. Next, early in the clinical placement, ideally on the first day or at least in the first week, you should discuss your expectations for patient assessments. This may include how you want the student to present the patient to you in terms of patient information and their data, and a good time frame for when you would expect a patient assessment to be completed. Ensure your student can compile a thorough database, and it is helpful to assign straightforward, simple patients with relatively few comorbidities early on. It is extremely important that you review thoroughly to ensure your student has a good grasp on the process and that their assessments are comprehensive. As the student moves through the placement, you should be able to assign more complex patients and also increase patient workload. So this last section involves precepting drug therapy assessment in my own practice. When I have a student or resident with me, I would have the student compile a list of current as well as previous medical problems from their assigned patient, so ideally making a list of their medical conditions. Next, I would have the student prioritize them, often starting with the reason for their admission to the facility, or you could use the reason for their encounter or consultation. The next step in the process is to focus the student to start with the highest priority medical problem and begin movement through the flow chart. Your student should use one cycle of the flow chart per medication used for each medical condition, and multiple cycles for conditions requiring multiple therapies. So for instance, if your student's patient has hypothyroidism, your student would then complete one cycle of the flow diagram evaluating levothyroxine. If your student's patient had systolic heart failure, then your student should complete several cycles through the flow diagram evaluating different classes of medications used for that particular condition. For instance, your student should evaluate one cycle with ACE inhibition, a second cycle for diuretics, and a third cycle for beta blockers. Once all cycles have been completed for one particular medical condition, it is important then to assess therapy for the next medical problem in your prioritized list. And then you would continue on and rinse repeat until all medical conditions have been thoroughly evaluated. As drug therapy problems are identified by the flow diagram, formulate a list of problems that can be resolved. Then, prioritize solvable drug therapy problems in terms of clinical relevance and the time frame in which they should be resolved. And lastly, it is time now to move on to the next steps into the process of care, and that is resolving drug therapy problems.